We're now joined by Nancy Holecek, Executive Vice President, Chief Nursing Officer at RWJBarnabas Health, one of the significant underwriters of public broadcasting, including our production company. Nancy, first of all, thank you for joining us.
Thank you, Steve. Thank you for having me.
Make the connection between human trafficking and the healthcare system, but also nurses in particular, please.
Absolutely. So human trafficking is a global and local issue. And if you don't mind me just quoting a couple of percentages, globally, it's about approximately 25 million folks are trafficked globally. And 1 in 4 of those are children. 71% are women or girls, and 29% are men or boys. And of that 25 million, in New Jersey, unfortunately, we have the 13th highest call volume in the United States and 9th, where we are 9th in the US for reported cases. The link between those numbers that I just shared, human trafficking, and our healthcare system and our nurses and clinicians in particular, is because at least 80%, if not a little bit more, of those victims who are trafficked do seek healthcare while they're being trafficked. 63% seek healthcare in an emergency department, and others may seek healthcare in a dental office or for substance abuse, various other environments. And so there is absolutely the opportunity for our nurses and our clinicians to be the first point of contact for those that are most vulnerable and to make that connection.
But Nancy, help us understand this. First of all, I didn't even make the connection in my own mind between victims of human trafficking and the healthcare system. But what is the responsibility of a clinician, particularly a nurse, a physician, but a nurse, who, as we know, nurses often deal more directly with patients. What exactly could and should they do, Nancy?
Well, it first really starts with raising awareness, Steve, and education. And so partnering with state agencies and making sure we have great relationships and partnerships with our local law enforcement, making sure that there's bidirectional education around this particular issue, providing our staff, our clinicians and our staff with the appropriate tools, evidence-based tools to screen, to be aware and sensitive to folks that come in that may be acting a little bit differently, either looking for emotional signs or for physical signs of abuse. And so, again, because these victims are seeking healthcare, and we are, as you said, usually probably the first person that sees them, it is really our opportunity to intervene. And when I say intervene, I say that not in an aggressive way or an assertive way, in a very sensitive way. So this is a sensitive subject, sensitive issue, and need to approach it cautiously and sensitively.
But real quick on this, Nancy, but many of these victims, if not all of them, are incredibly fearful of the potential reprisal of someone helping them and it be known that they asked for help or accepted help. It's complicated, is it not?
It's very complicated, Steve, and no doubt they are. I'm certain fearful. We have heard stories from survivors, and we may not make a referral on the first connection. We may just start a relationship with that victim. But that's why I say we approach it cautiously, sensitively, applying the evidence-based tools and the assessments that we know, and then gently approaching the subject in a private, safe location for that potential victim, asking questions, just something as simple as, do you need help? Are you okay? And letting them take it from there, giving them the power to make that decision at that time or seek us in the future.
Hey, Nancy, thank you so much. All the best to you and the team.
Thank you, Steve.
And also thank you to all the extraordinary nurses out there who never get enough attention.
Thank you, Steve.
Thank you, Nancy. I'm Steve Adubato. Thank you. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Kane University, the Turrell Fund, supporting Reimagine Childcare, TD Bank, Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, Choose New Jersey, MD Advantage Insurance Company, the Port Authority of New York and New Jersey, and by New Jersey Sharing Network. Promotional support provided by AM 970 The Answer, and by NorthJersey.com and Local IQ, part of the USA Today network.
Hi, I'm Dr. Sharif El-Nahal. Did you know that there are nearly 4,000 New Jerseyans waiting for a life-saving transplant? And 67% of those people are people of color. Just one organ and tissue donor can save 8 lives and enhance the lives of over 75 people. Let's come together to raise awareness in our diverse communities. Donation needs diversity. You have the power to make a difference. For more information or to become an organ and tissue donor, visit www.njsharingnetwork.org.